So let's open up in a word of prayer. Lord, I thank you so much for just giving me the energy to be here on this call. I thank you for Dr. Corrielus, who is completely busy all the time, just managing and navigating through just life in general, but also through the lives of his patients. I thank you, Father, for what he is bringing here for us to learn today. God, we're so busy thinking about all the things externally, but we don't oftentimes think about our internal bodies and our temple, God, that you have created for us. And we know that even in that, sometimes the enemy attempts to attack it so that we can't fulfill the things and purposes that you've called us to do. So I just pray, Father, that we would be present. We would be able to hear clearly what thus saith the Lord. I pray that you would bless this man of God. And I thank you for all that he pours out to the community. And I also pray, Lord, for the vision that he has to continue to help the community, that there be a woman here that have both the skill set, time, talent, and attention to serve in the capacity of his need, God, that she would raise her hand and move forward. It's all these things we ask in Jesus' name we pray. Amen. So I have the honor tonight, ladies, of introducing you to Dr. Corrielus. He's a board certified cardiologist. He's the president and CEO of Corrielus Cardiology. And he has more than 22 years of dedicated service. He's pioneered and innovated a holistic approach to cardiovascular care, which is very rare, and we don't really hear that. Dr. Corrielus merges traditional patient care standards with heart-centered wellness practices. He emphasizes prevention. He's huge on that. I remember him telling me, hey, just take 10 minutes a day, walk, breathe, be still, right? He's about collaboration, and he's definitely a community healthcare advocate. He's the founder of a community cardiovascular initiative, and he has led efforts to reduce health disparities, provide much needed education and resources in underserved communities. His expertise spans advanced cardiology practices into nuclear cardiology, echocardiology, cardiac CT, and cardiac catheterization. He's a trusted voice in this space, and he's authored two influential books: Hypertension, The Killing Silent Killer, Healing, the Spartan, A Breakthrough Plan to Heart Health and Longevity. I'm sorry, I'm trying to keep from coughing. The truth of the matter is, you can find all of this on his website, and I will tell you under Corrielus Cardiology, but I'll tell you, he is an awesome man of God. He is truly, truly committed to the community, and I love his approach about healthcare and how he thinks in general. So, without further ado, thank you, Dr. Corrielus, for being on here and sharing your time with us today. So we won't keep you long. This is typically like a 45-minute session, and then we open it up for questions and answers, should any of the ladies have that. And I'll just let you begin to share, and then I do have a couple questions for you.
Thank you so much, Terri. Thank you for the very generous introduction. And to the ladies who are joining us this evening, I want to welcome you, and I want to honor you and thank you for having me. And like Terri said, I am Dr. Sanul Corrielus, and I am a board-certified cardiologist. I'm the CEO of Corrielus Cardiology and the founder of Community Cardiovascular Initiative. And the mission of CCI is really to do exactly what we're doing here, really having thoughtful discussions about heart health so that we can be proactive, so that we can know about thyself, thy heart, so that we can be intentional about the things that we do that are going to elevate our heart so that we can continue to live a well-fulfilled life, fulfilling the mission that God has set out for us. So that's why we're here this evening, and I'm simply a conduit. I'm simply a messenger to really pass on the message tonight to you about your heart health. So I have some slides that I want to share as we are leading into the discussion. But I want this to be a discussion. I want this to be about you. It's about really you getting the information that is going to move you towards your better heart health. That is the calling for me tonight. So I believe I should be able to share the slides. Is that right, Terri?
Yes, you
Right?
should.
Okay. Let me see here. Share. Okay.
Hello.
Okay. So I hope you are able to see my slides.
Yes.
Okay, perfect. So we'll move right into uh again, why talk about the heart? Why talk about the heart? Because I think it is important that we know that the heart is the most important organ of the body, right? Knowing about or minding your heart business should be your number one priority. And for that matter, we should understand that even God, when God created us, the first organ that God created was the heart. And the heart is connected to every other organs for one reason, because it is a very essential organ. And so as we go about our health, our mission in life, we should keep that in mind so that we can continue to elevate and maintain our heart health, so that we can be sustainable, viable, and continue to fulfill God's mission for us. So um, tonight we're gonna move into understanding what is the anatomy of the heart, what are some of the disease processes that can settle into the heart, especially talking about hypertension, heart disease. We're going to talk about some of the management strategies that are available now to us, and I'm gonna give you my approach to heart health management. That is the holistic, that to me is really the holistic approach. And we talk about a little bit about diet, and we're going to talk about stress, which is the number one factors that lead to disease state in the heart. And finally, we'll finish up by talking about hypertension, which we talked about, as Terry mentioned, is the silent killer. And that's the condition number primarily that's leading to the disease states that we see in everyday life in my practice, and that's second to stress itself. We'll talk about that. So what is the heart, right? When we talk about the cardiovascular system, we're talking about the heart is a pump, and it pumps blood to vital organs of the body. So so what is blood? Blood carries oxygen. So without oxygen, there's no life. Without the flow of blood, flow of oxygen to our vital organs, there's no life. So the energy, everything that we do, the ability to be able to get out of our bed, to be able to go and do things is really directly related to our heart ability to pump the blood from one organ to the next to give us that ability to doing that. And so the pumping function is very important, but as well as the mechanism to which the blood goes to the vital organs. That's through the arteries. The arteries that we are most concerned about a lot of times, arteries of the heart. A lot of times, what leads to the disease states, it's really the arteries getting plaque building up into them that impair the flow of blood to the vital organs. When you're talking about the heart, we're talking about if you have blockages in the arteries of the blood, of the arteries of the that are leading blood to the vital organs of the heart, then you're talking about that's how you get heart attacks. If you have blockages in the arteries that brings blood to the brain, that's what leads to stroke. So a lot of times we see a lot of disease state in the flow of blood from the heart to vital organs through the arteries being clogged up. And we need to understand that clogging function is not healthy, it's not conducive to health. And we need to understand what are some of those things that we may be doing that may be causing the arteries to be clogged up. And so we'll get into some of those factors, but that's one when we talk about heart disease, when you talk about things that can impair, that can get in the way of our sustainability, our longevity, is really the flow of the blood from the vital organs of the heart to the other organs that allow us to do what we do on a daily basis. And so what are some of those things that we have available now that can help to improve the flow of the blood from the heart to vital organs, and especially if we have plaque building up in the arteries. There are a lot of medications. We're not short of medications, that's for sure. We have blood, so a lot of times if you have high blood pressure that's leading to the clogging of the arteries, we have blood pressure medications. There are diabetes. Diabetes is another condition that can predispose us to the plaque building up in the arteries. So there are medications for diabetes. And also there's obesity is a leading cause of arteries being clogged, of heart disease. We have medications for that as well. And other things, smoking is a leading cause. People who smoke tend to have more likely to have impaired flow of the arteries or developing atherosclerotic disease. So we have medications that can lead to help people to stop smoking. And there's lastly, high cholesterol. So if people have high cholesterol, you tend to have the plaque building up in the arteries, and we have medications for that as well. So there are a number of medications. If you go to the doctors, they will give you a number of medications in line with every one of these conditions that can help to, again, to treat the conditions or the predispositions to the atherosclerotic disease, the plaque building up in the arteries of the heart, and in order to continue to facilitate the flow of blood to vital organs of the body. There's also surgical intervention. Like, for example, if you have conditions like if you have plaque building up to the extent where there is a significant impairment of the blood flow to the vital organs of the body, like, for example, in the heart, for example, a lot of times you hear people needing to have bypass surgery. That's a condition where the plaques that are in the arteries are significantly impairing the flow of blood, and it is extensive to the point where they use different arteries that are healthy in the body, and then they are able to bypass the blockage that is in existence in the heart. And they can do it also in the legs. They can do it in the abdomen as well. And for that matter, a lot of times when you get to that condition, that means that you need to be not just getting the surgery, but also you need to have medications on top of that to help you to remediate the flow impairment that you are experiencing. So that's where the surgical interventions come in. And sometimes they even put their condition, the blockage is not extensive, they can use what we call stents. So you may know some people who have heart disease where they're required to have stents in the arteries. And so even after the stents, you still need to take medications. So it's not a one and done thing. When you get to the point of needing surgery, you need to have medications on top of the surgical intervention. And once you get the surgery, once you get to that point where you need the surgical intervention, that means the disease has really settled in to the point where you probably it's never going to be the same. It's never going to be the same. And so that's why it's so important that we take a holistic preventive approach, because when you are mindful of your heart, when you move on a day-to-day basis to making healthy choices that are going to help to prevent the arteries of the heart from getting clogged, or the arteries of the vital organs from getting clogged, that is, of course, the best option. That is the message that I want to bring you tonight, that you want to really be proactive in terms of some of those things that you do that are going to lead you to better and healthier options, right? And so what are some of those things that brings you the holistic approach beyond everything that we just talked about? Okay, so it's really understanding the whole disease process. So the atherosclerotic disease, the plaque building up, is all fueled by not, it's a heart disease is a lifestyle disease. It's fueled by what we do, what you do on a daily basis. It's really what you eat. It's really how much stress that you are faced with, and it's really how much you are managing the stress. And so a lot of times when we talk about stress, and I have some slides on that, stress is the number one factor that's a lot of times that you and I face, that you and I, in a day-to-day basis, there's no way that you are not going to be faced with a lot of things that you have to manage. And that is a lot of times leading you to stress. But the thing about stress is it can be a good thing, but in the acutely, because it really tells your body, hey, I need you to really amp things up for me. Give me more energy so I can fight whatever it is that I'm faced with. But so there's a lot of hormones. There's a lot of substances that are being released to help you in that process, like a lot of serotonin, or there are a lot of stress hormones that are being released. In the short term, it's all good, but in the long term, that's when it causes damages. When what we call the chronic stress. The chronic stress, when the heart is really faced with a lot of the catecholamines in the long run, the stress hormones, it really causes it leads to the inflammatory process. It leads to the arteries to start getting inflamed, and that's when the plaque starts to build up. So by understanding that, then you want to be able to really manage your stress in the long term. So you need strategies, you need to practice those measures that are going to help you to really be mining the state of your arteries, so your arteries are not staying inflamed. And so that's where the holistic management comes in. That's where really the proactive management comes in. Okay, so first is really having a good stress management strategy. Some people do yoga, some people do meditation. I recommend, a lot of my patients to do to journal, to do gratitude journaling. And when you do gratitude journaling, it really helps you to really stay in the present, stay in the mindful, be mindful of really all the great things that are happening to you, as opposed to really focusing on some of those other things that may be causing you more anxiety and more stress. So among all things that I've just mentioned, all the medications that I've mentioned, really the thing about gratitude, the benefits that your body gets from really practicing gratitude on a daily basis, on a consistent basis, really outweigh the benefit from all those medications, believe it or not. And so I will definitely encourage you to be mindful of really practicing, making that part of your daily activities. Gratitude, being grateful of what you do. Make gratitude part of your attitude is what I really often tell people. And so the other things that you do to go in line with that is really what you eat. Yeah, when really you need to understand that you are what you eat. So a lot of times the stress the stress will lead you to really crave food that are like more like what they call comfort food, a lot of carbs, which are not going to be as friendly, as healthy to the arteries. So you want to make sure that your diet is rich in greens and vegetables. That's going to really help you to be have a less inflammatory process. A lot of micronutrients comes with the greens, the berries, a lot of the foods that are really on the healthier side for you to be able to help you sustain. And exercise, it goes without saying, when you exercise, you release a lot of substances that are anti-inflammatory, that decrease the inflammation, that really helps your arteries to be healthy, to be really allow the flow of blood to continue to propel. And we talked about some of the things that you can do in terms of the stress management and so on. So again, with the food, the green tells you that really that's universal. You go with the vegetables, the fruits, the whole grains, nuts, seeds, the legumes, moderate amount of coffee. I know a lot of us, especially when we're stressed, day-to-day life, we do consume a lot of coffee, and understand that coffee is a stimulant. It is a stimulant. It's part of when you're talking about stimulant, the stress hormones are stimulating, right? And so they are so a lot of coffee falls in that same category, right? So it really revved up the heart, so putting a lot of stress on it. So definitely moderate amount of coffee and tea. We say tea because tea, believe it or not, a lot of times the tea very caffeinated, a lot of caffeine. So the substance there is the caffeine, and so definitely we want to stay away from refined grains and ultra processed food, and those and the added sugars, the processed meat, the red meat, all that is definitely those are things that you want to limit in your diet. And certainly very important to do moderate amount of alcohol. And moderate is one drink for you ladies. It's one drink, and for guys it's 1 to 2. So again, your plate should be very colorful. If your plate is not colorful, you want to have the grains, the protein, the vegetables, the fruits, and for the very reasons that I've mentioned, the antioxidant effect that you get from the fruits and the fibers. So stress management, we talked about. All the stress. So the takeaway is really knowing who the enemies are when it comes to really what you are fighting against when it comes to your heart health. And the number one enemy is stress. Okay. So be mindful of your stress. Have a strategy, a plan that's going to help you to be able to manage your stress, and do not let the chronic stress take over. Always try to balance as much as possible to the mindfulness, to the different practices that you're going to have in place, and be aware of and try to incorporate gratitude into your regimen. So the other killer, the other enemy we should be mindful of is high blood pressure, hypertension. Hypertension can exist in isolation, what we call idiopathic hypertension. It can also be part secondary to stress. Some people are, when you're stressed, your blood pressure goes up, especially when you're talking about chronic stress. So that's why, that's why I'm identifying those two as the two biggest threats that you want to be mindful of, that I want you to take away a plan, a strategy that you're going to be able to tackle. So let's talk about hypertension. Hypertension is really, let's see, high blood pressure uh, is really the pressure against which the heart pumps, right? So when the heart pumps into the main artery, which is the aorta, the pressure that that we measure is the pressure that the aorta it's felt in the aorta. A lot of times, the aorta, which is the main artery that stems out of the heart, can be very relaxed. It can be very malleable. So when the pressure the heart pumps, the pressure doesn't go up. But sometimes the artery can be very stiff to the point almost like a pipe. And so that's how your pressure can rise as the heart pumps against the main artery. And when you face the high blood pressure, we're talking about a pressure that in the top number, the systolic number is greater than 120 to 130, 129, the norm greater than 120. And then the bottom number, the diastolic, greater than 80. So we have new findings now to the different research that came out that now the tells us that the pressure of 129 to 120 to 130 is considered elevated now. Whereas before we used to think that it was any pressure lower than 140, but now the pressure needs to be in the 120 range, especially if we have other conditions like like diabetes, obesity, and other kidney conditions. All those things can be contributing to the arteries becoming clogged, leading to the clogging process. That's why the lower the blood pressure, the better. So, so normal blood pressure.
No, read the instructions. Pull it here.
So normal blood pressure that we should be aiming for is 120 over 80. We should know our numbers when we go to the doctors, that we know our numbers. We should actually have our own blood pressure cuffs to be able to measure our blood pressure to make sure that the blood pressure is staying in the low side. Of course, during exercise, the blood pressure tends to be higher. During stress, blood pressure can be higher. But for the most part, if we were resting, if you're sitting, the blood pressure should be in the 120 over 80 range. And so we'll talk about what are some of the causes of high blood pressure. We talk about there's idiopathic causes. We talk about smoking, diet, lack of exercise, alcohol, lack of sleep, a lot of those things, lack of exercise, and there's certain medications and certain things that we take that can lead to high blood pressure. And for that matter, for when we have high blood pressure, that's why we call it the silent killer. We don't tend to have any symptoms until something happens. We have the end organ damage, the heart attack, the stroke that comes with the high blood pressure. We do know that the longer the blood pressure remains high, you are at high risk for heart disease, stroke, dementia, kidney failure. And so that's why it's so important to be able to do practice those measures, and that will help to lead to lower blood pressure. And what are some of those things we can do on a daily basis? Exercise. Exercising, it's if you do 150 minutes of moderate exercise. Moderate exercise can be a brisk walk down the street. Okay, you take a brisk walk every day for, let's say, 30 minutes. You do that for 5 days. That's your exercise for the week. And if you do more vigorous exercises, you can do it less frequently. The bottom line is exercise helps to lower the blood pressure in the long run, and it also helps with managing stress as well, like we mentioned. So it's a double benefits that you get in exercising. So we talked about stress management. If you manage your stress, we talked about that can be beneficial to helping you lower your blood pressure too. If you have excess weight, really losing the weight is very helpful in lowering your blood pressure. There's a study that was published in 2016 that shows that if you lose 5% of your body weight, you stand to benefit from lowering your blood pressure and lowering your risk of heart disease and increase your longevity. If you smoke, quit it, because a lot of times it says it's easy for me to say quit it, but a lot of times people smoke because of stress. They're really looking for the nicotine to soothe them from the anxiety or the stress that they're experiencing. So rather than quitting the smoking, you need to understand why you smoke and try to find the things that are going to help you to target the primary reason that you're smoking, rather than just going cold turkey. Like, for example, if it's stress, then you start practicing some of those things that we talked about, that will help you to lower your stress, and so that you'll not be dependent on the smoking. Sleeping. Good sleep is very important for for managing your blood pressure and also a healthier heart. A lot of times, we don't understand it, but during sleep is when there's a lot of the healing of the body cleaning process is happening. All the waste is elimination happening through the body. And so it's very important that you get the rest and allow your body to do its cleansing process, and so that you can have a healthier blood pressure and a healthier heart. And so that's why, when I don't know if the guys have experienced it. I know I experienced it when I don't have a good night of sleep. I wake up groggy and just feeling just off. And so sleeping is very important. And there are things you can do if you're having trouble sleeping, to improve your sleep hygiene, to allow yourself to have the prescribed recommended amount of sleep is at least 6 hours, 6 to 8 hours, so that you can really allow your body to rest, allow your blood pressure to be maintained, and your heart to be healthy. So some of the things that can get in the way of your sleeping, we know that caffeine a lot of times can keep you awake, and eating too close to bedtime can be, or exercising and any kind of activities close to bedtime can be leading to your sleep interruptions. So try to avoid all those things, and really try to really make your home, your bedroom, your safe haven, and you make the temperature cool, and get under the blanket. And it allows you to really go, not just sleep, but get you into the deep sleep, the REM sleep. That's when really all the magic happens. So I cannot emphasize this enough, that sleeping is very important to your heart health, and you should plan for 6 to 8 hours of sleeping. And we talked about the diet. The most importantly, I want to mention about the DASH diet, the dietary approaches to stop hypertension. It's a diet that's rich in potassium, calcium, and magnesium, and limits the sodium intake, fat intake, and the added sugar. That is the prescribed diet for lowering and maintaining a healthy blood pressure and a healthy heart. Okay, so So definitely, if you're not on a diet, on a DASH diet, I recommend that you start really putting those measures. And the reason why, and it's when you're taking a lot of those substances, especially the calcium, the potassium, it helps with what we call the uh, homeostasis. It's really what's gonna help your body to be at ease, so that you are able to maintain not only a healthier heart rate, but also you're able to sleep well. You're able to really get in at a point where all your organs, your systems are well regulated. So some of the things that can lead to the supplements for the DASH diet is really talking about we talked about the fruits and vegetables, but also the fish, poultry, beans, the nuts, the seeds, etc. Okay. So these are some of the food that are rich in potassium. Potassium, we talking about a lot of times bananas, the oranges, all the really citrus fruits, the greens. You have the broccolis, the leafy greens, your zucchinis. All those should be part of your diet. You try to incorporate as much of those in your daily intake, and clearly we're talking about a diet that's again, when you look at your plate, it's very colorful, very colorful. Magnesium is a vasodilator. It helps the arteries to relax. So it also helps with your sleep. So it's calming. So definitely on the foods that are rich in magnesium, you want to make sure that you take notes of the pumpkin seeds. You have the almonds, cashews, the spinach, the beans, okay, the quinoa. Those are good sources for your potassium. Calcium as well. Calcium is good. It's good for a healthy blood pressure, and a healthy heart function. So those are some of the food that you will get your share of calcium, including, of course, your dairy products, but not limited to those. Again, I want to make sure that you're aware that high sodium diet can lead to to high blood pressure in many instances, because you tend to, when you eat a lot of food that are rich in sodium, you tend to retain a lot of water. And when you retain a lot of water, that can lead to the blood pressure being elevated. Okay. Sugar, be mindful of sugar. Okay. The flours, the processed flours, white flours, those are generally high glycemic index, and the high glycemic index will lead to, diabetic, hyperglycemic state, and that is part of the inflammatory process, and that can lead to high blood pressure. So be mindful of those and try to limit those. And for the most part, drink a lot of water. Water is the best drink for you. A lot of times it really helps to cleanse you, to really people are talking about all those different detox, but really the really best best place to start is really in making sure that you have plenty of water, staying hydrated, especially in the as you are busy, you are stressed. A lot of times you tend to really neglect your intake, your water intake, and the way that you will know that is you'll feel foggy, and you feel a slight headache. And a lot of times people will run to caffeine, to drink coffee to try to treat that. But the thing that you need to be aware of as well is that caffeine is a diuretic. When you drink a lot of coffee, you tend to lose a lot of your body water intake, and also a lot of your electrolytes, especially your potassium and whatnot. That's why you want to make sure that you stay hydrated at all time, and then you take food that are rich in the minerals, especially the potassium and the magnesium, so that you have a balance in your electrolytes in your body that will help to keep your heart pumping healthy. So that's what we have. I want to stop here to take in some questions for you from you. I'm sure you have uh, many more questions, Terry. Happy to take them and make open it up to the group for any more questions that anyone may have.
Thank you so much, Dr. Corrielus. I want to say, ladies, I hope we caught it's the stress piece for me. Um, Dr. Corrielus has been instrumental even in my life at that time. As everybody knows, pretty much here, that I'm an entrepreneur and life is busy. I'm a mom, I'm a wife, I'm a ministry leader. There's a variety of things that we do. And the key for me was when he said, I think you told me that most women, and specifically also women of color, their number one death or cause of death is heart attacks. And there still isn't, we don't really know. It's when it happens, it's basically too late. And so it is a silent killer. And we don't really realize how stress ties to that. And we can have consistent stressors, right? Whether we're involved in business deals or just trying to be moms and manage everything that's in the process and support other people that are around us. It's a constant stress. And oftentimes we don't have time to exercise. We're eating on the go, and just making decisions like that. So I think it's important, even to when we're just going through life stressors, changing jobs, moving, grieving, right? All of those different types of things. And so, from a biblical perspective, I love too also that the whole gratitude journal that you were very intentional about saying, even to me, hey, I know you're busy, but take 10 minutes every day to just have quiet time, sit, and be still. And you told me to do deep breathing exercises and things like that. And we don't really realize how quickly our bodies can shift or change. And it only takes one incident for your whole life to change. And so I just want to say, for women, I want to open this up for questions for sure. But what would you tell somebody who is maybe on the verge of heart disease? Can heart disease, do you have to take medication? Because I know women who are like, their blood pressure raises, it might be inconsistent or it's consistent for a while, but they don't want to get on medication because medication starts affecting other organs. Do you think you can turn that heart health around where you don't have to be on medication? Or once
Yes,
you're on it, you're on it?
yes, absolutely, absolutely. There's something to be said about being intentional about being healthy. Uh, to be healthy is hard. It's expensive, and and it takes intentionality. It takes one to be committed to doing the work for just like anything else. And so I will say that yes, you can turn things around. I've seen cases where people have had plaque buildup in their arteries and they committed to changing their ways to adapt a more healthy lifestyle, and they have been able to turn things around, and the plaque regressed. So it goes without saying it's not gonna be easy, and there are things that you can start out with that will make things easier. That is, if a lot of times if it's if it's, let's say, hypertension, and let's say you have not been taking good care of yourself. You've put on some weights. You were busy with, you know, raising children, and you did not have the time to being able to really focus on you. Now you start doing basic things, and it doesn't have to be drastic measures. You know, like we said, you know, take a brisk walk for, 30 minutes, or if it's really start having more healthier choices in terms of diet, eating more lean and more greens, get more fruits, and drinking plenty of water, and staying away from, some of the processed foods, and the carbs, the processed carbs. And those are the basic things that you can do, and not discounting, managing your stress
Yep.
and sleeping. So those are key. So if you inject all these different elements to your new way of doing, or your new way of life, then absolutely you stand a chance of being able to stay away from having to be on medications, and really helping yourself by now being healthier, not having to deal with some of the adverse health consequences.
Thank you for that. I have two quick questions. Tracy, I see yours. Her says, thank you for the session. Can you speak about supplements, vitamins to go along with a healthy diet or questionable diet or exercise? So basically, it sounds like she's saying with exercise, are there any supplements or vitamins that you should be taking for heart health?
Yes, I believe I'm a strong believer in taking a multivitamin to help supplement our diet. A lot of times, we may not be taking all the elements, or maybe they're not, all the vitamins are not absorbed to the full extent. So one daily multivitamin, I think, is a very good addition to any diet. And in addition, for heart health, I recommend that you take, you have a healthy intake of minerals like magnesium, calcium, supplements, and vitamin D, especially, if you're spending a lot of time inside, you're not getting a chance to go outside to take your walks. So that would be a good supplement to add. And yeah, and of course, the dietary supplements of potassium with rich foods would be also make sure that you have that.
Thank you for that. And Dr. Corrielus, Tracy, one of the things I take is something called Trace Minerals. It's a multivitamin and it's a liquid vitamin. What I've learned with vitamins is that you can take a vitamin. I know people buy them off the shelf, but one way that helps me understand if it really digests in my stomach is I'll take apple cider vinegar. I'll drop the vitamin or the pill in there and let it sit for 24 hours. If it's not dissolved or comes back, because apple cider vinegar is the same acidity or closest to the same acidity in our gut. So that'll tell you if those vitamins are actually really breaking down in your body the way that they should. I prefer trace minerals because it is all liquid and I can fill it right away. And it's a great multivitamin and it has all of those things that Dr. Corrielus is saying. Jeanette, you have a great question. So this is actually a question that Jeanette had in another, they're the same thing. So I'm going to try to ask it all in one. Jeanette says, great presentation, Dr. Corrielus. Regards to women and hormone changes as we get older. A lot of times weight gain, high cholesterol, lack of sleep is caused by hormone changes. Amen, girl. Even if you're eating properly and exercising and managing stress. So what do you suggest for women dealing with this?
Yeah, yes, I think that's a great question that goes without saying that if you are going through the changes, it's always good to know what your hormone levels are. I certainly recommend that you check with your gynecologist, know what your levels are. Sometimes, having some supplementation is very helpful to be able to really help you to be at par so that you're able to sleep, you're able to really have a balance in your homeostasis so that you can continue to thrive. But in addition to the hormonal supplements, I would say that you would take general vitamins and minerals that I have mentioned that will help to really help you to maintain a healthy heart.
Thank you so much for that. Yeah, hormones, boy, that's a challenge, but
Mhm.
I hear they have all these kind of cool things now for you to technically understand how much testosterone and estrogen you need and help you with your weight. So that's good. The other thing is, what are some early warning signs of high blood pressure that women should never ignore? Because nobody ever knows, since we know it's a silent killer, but sometimes you might get a feeling, you hear about men having numbness in their arm or whatever. Like, what are the signs and symptoms potentially?
Yeah. Yeah, so that's a great question. I mean, I think especially women, a lot of times you guys don't follow the books, and so it's a typical presentation is what we see a lot of in women. So so one of the things that you want to be mindful of is really knowing your body, right? Knowing your body. So when you know your body, then you are going to pay attention to the nuances, the different sensations or feelings that you may have, even if it's a jaw pain and discomfort in the jaw or in the shoulders. And of course, if you're having chest pain, any kind of chest pain should not go unattended to. If you start getting fatigue, more fatigue than usual, right? Especially you're getting your good night of rest, and then you still find that you're not able to do what you normally are able to do. Like you're able to normally go up the stairs, and all of a sudden you have to stop halfway. Those are signs that you want to pay attention to, that you want to get addressed. And so those are the main ones that I will say, and also paying attention to making sure that your blood pressure, your numbers is important as well. Knowing your numbers, there are a number of commercially available blood pressure cuffs. Omni is one of them that I recommend, and that's what you can get that at CVS. And a good one will cost you about $75. I will not get anything less than that. There are some that now can take the pressure in the wrist. I'll stay away from that one. But definitely you want a good blood pressure cuff so that you know your numbers at all time. And when you check it around the same time. Check it the same time. Let's say if it's in the evening at this time, every day that's the convenient time for you, then check it at that time so that you'll have a more consistent, reliable number to go with. Because understand that the blood pressure does tend to fluctuate. It fluctuates depending on what the activities that you're doing and whatever else is going on at any given time. So that's why it's good to take it at the same time at all time.
Thank you for that. And I have, I think, two more questions.
Mhm.
Uh, Hi, Yasmin. I saw you say hi. I didn't see that until I scrolled up. Nicole says, thank you for your time and expertise. I wanted to ask if there are any additional tests we should consider requesting at our annual physicals that aren't usually done. Also, in your experience, are there any long-term cardiovascular risk for someone living with only one kidney, particularly as a kidney donor? So the first part of her question is, which was this other question was, how often should you see a cardiologist? But hers is, should you ask for any additional tests to consider at your annual physical regarding your heart? And then the other one is are there any um, long-term cardiovascular risk for someone living with only one kidney,
Okay.
who's donating one kidney?
Okay, I'll take the first part of the question. In terms of how often should you get cardiovascular testings done, and I will say we don't get heart checkups enough. Okay. I think because the heart is such a critical organ, I think we should, just like there's baby check, I think we should, as we get into maybe 45, between 45 and 50, we should start thinking about getting a heart checkup. A heart checkup will entail getting not only blood tests, but also get an ultrasound of the heart, get an electrocardiogram of the heart, and also get more specialized blood testings, which I will add lipoprotein, uh, LP little a, lipoprotein A little a is one of the blood tests that's now is coming out as one of the markers for high predictability for heart disease. And so making that part of the overall profile of the testings that you get done in addition to the traditional blood tests will give you more information in terms of where your risk stands and will give you more information again to be able to act on next step and know where you stand. And so
Can I
the
just summarize that for her? So, Nicole, it sounds like she's asking too, could she ask that by her regular physician? Or is that something she would see her physician and then come to a cardiologist for?
well, I'll say, Nicole, I don't know where you are, but a lot of times
She's in DC area, I think. I could
DC
be wrong.
area. Okay, if you don't have access to a cardiologist, then you could
ATL.
request
She's in ATL. Sorry.
ATL. Okay. I know ATL they have a lot of cardiologists. In fact, I have a couple of friends down there. I'm happy to refer you, but you should definitely get your heart checkup with a cardiologist. That's where you're gonna get the full slew of testings, not just blood tests, but also the other testings I mentioned, the ultrasound, the electrocardiogram. Because when it comes to heart disease, it's really what you want to know as close as possible is your risk. What is your risk profile? And the more information that you have to be able to narrow down your risk profile, the better, the more accurate that you are going to be. Okay, so that's why when you go to a primary care doctor, you're gonna get one test. Obviously, it's with one test, you're not gonna be as accurate as if you have five tests that are able to really put it all together for you. So you'll get more accurate information by seeing a cardiologist than if you go to the primary care doctor. So essentially, I hope that answers the first part of the question. The second
Yeah.
part of the question is really with one kidney, are there any risk? There is not necessarily for as long as the kidney is working fine. Things that can affect the kidneys will be, if you have high blood pressure, then you want to be mindful of making sure that the blood pressure is controlled because you don't want that high blood pressure to affect that one kidney you have. And you want to be mindful of some of other things that can affect the kidneys. Like, for example, there's a lot of times when you take antibiotics or if you get dehydrated, if you take any other supplements that are filtered to the kidneys, they may put a stress or strain on the kidneys. So for the most part, it's really there's not a direct correlation between the one kidney and heart disease per se.
Thank you so much for that. I think Dr. Corrielus, that's all. She said thank you.
Sure.
She's considering, I think she's a candidate to donate a kidney to a friend. So that's why she's asking that question because she's willing to give her kidney to a friend. And so
I,
she
I see. Bless your heart. That's very kind and noble gesture of you to do. Yeah.
Before you head out, can you just, if you can remember, because I know when we were sitting on my couch at the house, we were talking through how God created our heart, right? It being the first thing and all what the heart does. Can you close us out on that? And then we'll close out in prayer. And I just again want to say thank you. I've had an opportunity, ladies, to work with Dr. Corrielus professionally, and he's also my cardiologist. And even when I go away, he's my cardiologist. Even when I move, he sends me to somebody, but he's still my cardiologist. And he's such an advocate for us and for our community. And there's such a need for us to get the type of care. He wants to be preventive and proactive. And so he's actually working on specific programs even today, where he can provide more concierge care to the community who needs it. Oftentimes, when we're finally arriving at the Dr. Corriellises of the world, we're in the later stage. And the idea is to, like he said, number one, identify our risk. What are the obstacles that are in our lives? How stressed are we? Are we writing in these gratitude journals? Are we praying? Are we sitting still and having quiet moments? What are we thankful for? Are we getting the sleep that we need? How are we resting in our body? Right? All of those types of things. How are we resting when we sleep? How are we taking care of ourselves? Are we getting exercise in that we need? The idea is to be preventive and be proactive, not reactive. Because once you start getting reactive, and I want to let you know, it's not just about obesity. I mean, my blood pressure was high. I'm a size 4. Sometimes I'm between a 2 and a 4. And I can tell you, I'm a vegetarian. I drank maybe half a cup of coffee in the morning, usually half calf. But my life, because of all my flights, I went, all over the world and busy and going and not enough sleep. And even though I was under stress, which would be normal stress as any entrepreneur who's running companies and things like that and having a family, I didn't realize how that was impacting my heart health. And so I would encourage you, don't just look at the scale because it's far beyond that. Stress is a true killer. And it's extremely important that's why God teaches us to have things in a specific order, right? And we can't do all things because we're not God, but we can, what we can do is manage our life. So he's given us control over certain things. So I wanted to say that, and I thank God that I'm under control now. I still have moments, and I have to be checked every now and then, but I'm a work in progress. And if not, I'm texting Dr. Corrielus. But he's serious about this. So, please continue to look out, check his website. I know that he has this coming. He's in the middle of building it. If there's a way that you can volunteer, he has an organization as well. He's located in the Philadelphia area. There are times that he pops around, including here in Atlanta. And so if you can get involved, please get involved if you're in that area because heart health is important and pay it forward. The other thing is, like I said, I want him to close out and just kind of talk about how God created the heart first. Um, yeah, Dion, I see your hands going up. He needs to be out there with your ladies for sure. Um, I want to, I don't know if you even remember how this is. Dr. Corrielus, I'm so mad that I didn't record you that day on the couch, but
Yeah,
I literally was in my chair crying because of how he described how God created the heart first before anything, right?
that's right. That's right. It's the first organ embryologically that was created, and for that matter, we have two sides of the heart that they have to coexist, and they have to coexist, and the left side and the right side, and if the right side is not well, the left side is not well either, and vice versa. And so it's a give and take. It's a give and take relationship. And so talking about God, what a creature, right? It's a give and take. So it's in order for the left side of the heart, which is really our that's what sustains our health, our life. When we're talking about the widowmaker, the widowmaker lies on the left side of the heart, and that's what pumps the blood to the vital organs, the left side of the heart. In order for it to give, to pump out, in order for it to receive, right? In order for it to fill, it has to give. So talking about our life, talking about what we take from what we do on a daily basis. A lot of times we think about really how we need to be in the getting, but one thing that I take away from being a cardiologist and understanding the heart and understand the greater power in the creation of the heart is that we have to think about giving
Amen.
first. We have to think about giving
Amen.
before we can be filled. So the squeezing of the left ventricle to give life is the first thing that has to happen before the left ventricle can get filled and then give again. So I applaud you all for being here this evening and being part of this discussion. And I hope that I was able to give you enough that you are now empowered to go and give great more abundantly to the people around you, to the people who are in your circle, so that we can continue to have a fulfilled life in the communities that we serve.
Amen. And if I can just say that, hey, Deanna, I know you're on this call. She just says she's in Philly. She needs a new heart doctor. So I'll be sending her and her family to you. But I will tell you this, that to me is the piece that changed my life. In order for you to be filled, you have to give. So you give first in order to be filled. And isn't it amazing that God has given his only begotten son for us to be filled, and then we're giving, right? It's just this whole cycle. And to think that the moment that we are created, our brains aren't formed, our bodies aren't formed, our heart is formed. Our heart is formed. And the Bible talks about him being in our heart, right? And above all things, to guard our heart. And so I'm so grateful for you, Dr. Corrielus. You guys, he's an amazing, amazing, amazing person outside of him being an amazing friend and doctor. And again, I pray that these ladies, too, Dr. Corrielus, are all gifted and talented in different ways. And my prayer is that we can help you get the information out. I know I'd be busy sometimes, but my heart is to help you at least be visible, because I know you're here to help make an impact for all of the families, and you do it so effortlessly and with true authentic love. So many times doctors are checking you in, checking you out, and getting you out of there. And I know you're busy, but we only have one heart, right? So thank you so much.
Thank you.
And I'll pray us out. Lord, I thank you for tonight's lesson. I pray that we walk away, God, just a little bit more informed, but not just informed, transformed by the words of Dr. Corrielus. I pray, Father, that you would bless his hands, that you would give him favor, that you would continue to bless even his proactive ministry to help the underserved communities and people know more about heart health. I thank you, God, that even his traumatic story with his dad, which is how he even got through or involved in this, was to make a difference. So people had access to education and healthcare around their bodies. Father, oftentimes we're so denied because either we don't have enough or things are too costly or we're too fearful. But Father, that's a trick of the enemy. I pray, God, that we would learn more about our temples, that we would make sure that we rest well, we eat well, we exercise, and we take care of these bodies that you've given us on earth that are basically the housing of our soul. So, Father, I just pray for every woman under the sound of my voice. I pray that they would connect, and if there's an opportunity where they can even begin to serve and help him in his mission in ministry to get more of the word out for preventive health care, or even help him build what he is building. I pray that you would just prick the heart of that woman and let her be confident in her and courageous in her reaching out. Thank you for tonight, and thank you for keeping me without coughing all through this. In Jesus' name, amen.